For a client with disseminated herpes zoster, the best initial infection control action is to place them in a negative pressure room with airborne and contact precautions. This approach prevents the spread of infection, as droplet or standard precautions are inadequate, and semi-private rooms expose others to risk. In a client with hyperkalemia showing muscle weakness and ECG changes, the priority intervention is administering IV calcium gluconate. This stabilizes cardiac membranes when ECG changes are present. Other treatments like insulin dextrose shift potassium, but do not provide immediate stabilization. If titling ceases and the client is dyspneic after chest tube placement for pneumothorax, the first action is to assess the system for dependent loops, kinks, or disconnections. This addresses potential obstructions or disconnections, which are common causes of such symptoms. For a client with small cell lung cancer and severe hyponatremia, implementing seizure precautions is the priority. SIADH with severe hyponatremia poses a significant seizure risk, and safety must be prioritized over other interventions. 2 hours post-vaginal birth, if the uterus is boggy and displaced, assist the client to void. This action addresses bladder distension, which is often the cause of uterine displacement. Other interventions like massage or medication are secondary if atony persists. In a young adult with type 1 diabetes and DKA, the priority initial prescription is a 0.9% normal saline bolus. This restores perfusion, which is critical in DKA management. Insulin is administered after fluid resuscitation to address hyperglycemia. For a client presenting with stroke symptoms and high blood pressure, the best next step is to lower BP to 185/110 before administering alteplase if eligible. This ensures the client meets the criteria for TPA administration, optimizing treatment efficacy. In a febrile 4-year-old with signs of epiglottitis, the priority action is to keep calm, apply humidified O2, and prepare for airway management. Avoid throat manipulation, as it can worsen obstruction. Airway readiness is crucial in such cases. For a heart failure client on furosemide and digoxin, hypokalemia is the most concerning finding. Low potassium levels significantly increase the risk of digoxin toxicity, making it a priority to address this electrolyte imbalance. When a client with a valid DNR/DNI experiences apnea and the family requests full intervention, the nurse must honor the DNR and provide comfort measures. This respects the patient's autonomy and legal directives, avoiding unnecessary interventions. Repositioning a stable paraplegic client every 2 hours is appropriate to delegate to an experienced UAP. This task falls within the UAP's role, while teaching, assessment, and titration require RN judgment. In a client with 35% TBSA burns, urine output of 0.5 to 1 ml/kg/HR best indicates adequate perfusion. This measure is the most sensitive indicator of effective fluid resuscitation, as other parameters may vary. For a client starting isoniazid for latent TB, the most important teaching is to report numbness or tingling, as vitamin B6 helps prevent peripheral neuropathy. This side effect is a known risk of INH therapy. In pre-op screening, an allergy to bananas and kiwis requires latex-free precautions. These allergies cross-react with latex, unlike shellfish, penicillin, or pollen, which are unrelated to latex sensitivity. For a client on magnesium sulfate with signs of toxicity, such as low respiratory rate and absent DTRs, the priority is to stop the infusion and prepare calcium gluconate. This antidote addresses magnesium toxicity effectively. In an 82-year-old with acute confusion post-UTI, the best initial intervention is to provide reorientation, ensure sensory aids, and implement fall precautions. This approach addresses delirium by focusing on environmental and safety measures. For a client with respiratory acidosis and hypoxemia, prepare for non-invasive ventilation and administer bronchodilators. This supports ventilation and addresses the underlying respiratory failure, avoiding complications from hyperventilation or excessive oxygen. 6 hours post-thyroidectomy, if a client reports tingling and cramps, check for Kovostek sign, notify the provider, and prepare IV calcium gluconate. This addresses potential hypocalcemia due to hypoparathyroidism. If dopamine IV infiltrates, the priority action is to stop the infusion, leave the catheter, aspirate the drug, and prepare the antidote. This approach prevents further tissue damage from vesicant extravasation. To limit C. Difficile transmission, hand washing with soap and water plus sporicidal cleaning is essential. Alcohol-based hand rubs are ineffective against C. diff spores, and proper cleaning practices are crucial.